Welcome. Today we're diving into polycystic ovary syndrome, or PCOS, a common yet complex hormonal disorder affecting women of reproductive age. Understanding PCOS is crucial for early diagnosis and effective management, so let's get started. The exact cause of PCOS remains a mystery, but research suggests a combination of genetic and environmental factors plays a significant role. Insulin resistance, where the body doesn't respond properly to insulin, and elevated levels of androgens, often called male hormones, are key players in development of PCOS. Family history also increases your risk, suggesting a hereditary component. PS throws the normal hormonal balance in the body off kilter. Insulin resistance leads to higher insulin levels, which then stimulate the ovaries to produce excess androgens. These androgens disrupt the development and release of eggs, resulting in irregular or absent ovulation. This imbalance also contributes to the development of cysts on the ovaries, though not all women with PCOS have cysts. PCOS is a widespread condition, affecting an estimated 6 to 12% of women of reproductive age globally. This makes it one of the most common endocrine disorders among women. While it can affect women of all races and ethnicities, studies suggest that certain populations may be at a higher risk. It's important to remember that these are estimates, and the true prevalence might be even higher due to underdiagnosis. The signs and symptoms of PCOS can vary greatly from woman to woman. Some of the most common include irregular periods, ranging from infrequent periods to prolonged or heavy bleeding. Many women also experience hirsutism, or excessive hair growth on the face, chest, or back. Acne, oily skin, weight gain, and thinning hair on the scalp are also frequent symptoms. Infertility, often due to irregular ovulation, is another major concern for women with PCOS. Over time, PCOS can also increase the risk of developing other health problems. Diagnosing PCOS can be challenging as there's no single test. Diagnosis typically involves a combination of factors based on the Rotterdam criteria. This includes a review of your medical history and symptoms, a physical exam, and blood tests to measure hormone levels, including androgens and insulin. An ultrasound may also be performed to examine the ovaries for cysts, although the presence of cysts alone is not sufficient for diagnosis. Doctors usually look for at least 2 out of 3 criteria: irregular periods, high androgen levels, and polycystic ovaries on ultrasound. While there aren't distinct subtypes of PCOS formally recognized in classification systems, the condition can manifest with varying degrees of prominence of its key features. Some women may primarily experience metabolic issues like insulin resistance, while others may have more pronounced androgenic symptoms such as hirsutism or acne. Understanding which features are most prominent helps tailor treatment approaches. There's no cure for PCOS, but the condition can be effectively managed to alleviate symptoms and reduce long-term health risks. Treatment strategies are individualized and depend on the specific concerns of the patient. Lifestyle modifications, including diet and exercise, are often the first line of defense. Medications, such as birth control pills, can help regulate periods and reduce androgen levels. Metformin can improve insulin sensitivity and help with ovulation. Fertility treatments like ovulation induction may be necessary for women who are trying to conceive. Managing associated conditions, such as high cholesterol or sleep apnea, is also an important part of the overall treatment plan. Currently, there's no proven way to completely prevent PCOS. However, adopting a healthy lifestyle, including maintaining a healthy weight, eating a balanced diet, and engaging in regular physical activity, can help manage insulin resistance and reduce the risk of developing some of the complications associated with PCOS. Early diagnosis and treatment are also crucial for preventing long-term health problems. The prognosis for women with PCOS varies depending on the individual and the effectiveness of management strategies. While PCOS can present challenges, with proper care, women can live healthy and fulfilling lives. Recent research is exploring the genetic underpinnings of PCOS and investigating new therapeutic targets. Studies are focusing on improving insulin sensitivity, reducing androgen production, and developing more effective fertility treatments. Scientists are also looking into the potential role of gut microbiota in the development and progression of PCOS, paving the way for innovative approaches to managing this complex condition.